Hello all, welcome to Pharmanandan. This is the part 2 video of Eicosanoids. Okay, welcome. So in the earlier part, in the part 1 video, we went through the what are the types of prostaglandins, what are the prostacyclins. So okay, we enlisted everything and the sites of their production and their action. In this video, we are going to cover the drugs which are acting on these prostanoids, right? So the first drug we are going to discuss now is alprostadil. So what is this alprostadil? It is PGE1 analog or PGE1 agonist. Okay. So what does this mean? That this PGE1, PGE2, all these are same. The thing is they are different in the chemical structure and the number of double bonds. Okay. End of the day, PGE1 acts on the same receptor on which PGE2 is acting. Why we differentiated all these things? Because comparatively, when we compare this, where is it? Yeah, this PGE1 when we compare with PGE2, one of the main difference is this PGE1 is not expensive thing. It is totally synthetic, purely synthetic. Okay, this PGU2 is expensive drugs. Okay, this is the main difference in during application. We should remember, right? Okay, so this PGE1 analog alprostadil, it has many uses. Okay, in males where it is used as intracavernous injection. It is used as intracavernous injection. What is the purpose? It is used in the diagnosis of erectile dysfunction. This is used as treatment of erectile dysfunction. Second line therapy, second line treatment. What is the first line treatment of erectile dysfunction? First line treatment of choice of erectile dysfunction? Yes, PDE5 inhibitors, sildenafil, all these things. What does this drug do? Alprostadil. What does this drug do? It inhibits platelet aggregation. Along with it, main thing which it does it acts through vasodilation of cavernous arterioles and compress venules. So what do we call all this thing together? We call this as corporo veno occlusive mechanism, right? And this alprostadil, it is you given as injection, I told you, right? Along with injection, it is available as pessary also. It is available as vaginal gels also. And one more thing, it has application in pediatric department. How this alprostadil has a role in pediatrics? In pediatrics, it is this alprostadil is used to temporarily maintain patent ductus arteriosus in any congenital heart diseases. like maybe transposition of arteries. Okay, in those conditions what happen is, okay, we need to maintain PDA as it is, because after delivery naturally PGE2 secretion is decreased, right? So when PGE2 secretion is decreased, what happens? Ductus arteriosus will be closed. It is what we want usually in healthy individuals. But when there is congenital heart disease, there is a demand that it should be patent till the infant is moved to operation theater, right? So till the infant is operated with surgery, before surgery this alprostadil is used to maintain patent ductal arteriosus temporarily. Temporarily. And what is the next drug? The next drugs are dinoproston, misoprostol, and enprostil. Coming to the dinoproston, what is this dinoproston? This is PGE2 analog, that is, it resembles the chemical structure in similar way to PGE. So straight away it acts on the same receptor of PGE2. What are the receptors on which this dinoproston is acting? All the four receptors of PGE2. What are the receptors of PGE2? We studied earlier PGE2. EP receptor 1, EP receptor 2, EP receptor 3, PGE, this is for prostanoid, receptor 4. It acts on all the four receptors. It acts on all the four receptors. Okay. So what does this cause? This causes cervical ripening. And the other drug is, next drug is misoprostol. Misoprostol is very popular drug. Usually we see it in medical termination of pregnancy. Okay, usually it is not used in normal labor. Okay, first thing, it is used in medical termination of pregnancy. The second point about misoprostol which we should remember, it is actually more effective than, what is the thing which we use for normal delivery, to induce normal delivery, or to for during the delivery process, to normal delivery process, right? Oxytocin, right? This misoprostol is more effective than oxytocin and the earlier drug dinoproston for the purpose of induction of normal labor. But this is not used during labor, because oxytocin is the primary choice of drug for induction of the labor. These misoprostol, these gives through more side effects, right? So oxytocin is safe. And the other condition where misoprostol is used is for the prevention and healing of NSAID induced gastric ulcers. So what is the primary choice of drug for gastric ulcer? Primary drug of choice is proton pump inhibitors. Okay, misoprostol is also used, but primary drug of choice is proton pump inhibitors. And the last drug in this page is N-prostil. Where is the where is this N-prostil used? This N-prostil is PGE2 analog. It acts on EP or 3 receptor only, where it is indicated. This is indicated in peptic ulcer. Got it? What are the next group of drugs? PGE1 analogs. What does this PG analogs do? They inhibit, yes, platelet aggregation. This is not main thing which we desire. Main thing about this PGI2 analogs is it causes vasodilation of pulmonary arteries and systemic arteries, both of them. What happens when there is vasodilation of pulmonary arteries and systemic arteries, both of them? We can see as a result there is decrease in peripheral vascular resistance. It is decreased. So what happens? What is the result of this? There will be improvement in blood flow. Improved blood flow. So when do we desire all these things? When there is pulmonary artery hypertension. It is a very morbid disease, that is the patient suffers a lot. He can't even do exercise, he can't walk, he can't do work. So it's a pathetic disease, pulmonary artery hypertension. What are the drugs? Biroprost. It is used in the grade 1 as per WHO, pulmonary artery hypertension and peripheral artery hypertension. What is the other drug? Iloprost. It is also used for the grade 1 category of primer pulmonary artery hypertension as per WHO grade 1, and treprostinil. This drug is also having same indication, pulmonary artery hypertension. And Selexipag. What is this Selexipag? How it is different from these things? All these drugs are analogs. These are similar in chemical structure, so they directly act on the receptor, right? This is a purely synthetic one which is not similar to the chemical structure. It is totally different in chemical structure, but it is acting as selectively, acting as agonist on prostaglandin I type of receptor. Okay, we call it as IP receptor. Okay, IP receptor agonist. What is its indication? Same thing. Pulmonary artery hypertension. And the one more most important drug is ipoprostinol. What are the things which we should remember about ipoprostinol is total 2 points which we should remember. Point number 1. It is used as continuous IV injection in pulmonary artery hypertension patients during long-term therapy. What is the purpose of this? To improve. Usually in pulmonary artery hypertension, our initial target is to improve this exercise capacity in a patient. The point number 2 for this ipoprostinol is this drug is contraindicated in pulmonary edema or if the patient is having congestive heart failure. Agreed? So, what are the next group of drugs? PGF2 alpha analogs. What are these PGF2 alpha analogs? Carboprost. It is a very powerful drug for uterine to stimulate these uterine contractions. That's why this carboprost is not used in first trimester medical termination of pregnancy. It is used in the second trimester medical termination of pregnancy or to stimulate even the gravid uterus also. To stimulate gravid uterus. How? By increasing myometrial contractions. But for this carboprast, there is a risk. We should be cautious about risk of there are chances of laceration of cervix. So we should be very careful while delivering the dose and at the proper timing of this carboplast. What are the other PGF2 alpha analogs? Bimatoprost, latanoprost, tafluprost. The final one is travoprost, where all these four drugs are used. These all of these four drugs are used as primary drug of choice for open angle glaucoma. And at last, leukotrienes. What are the drugs of acting on leukotrienes? What is the some physiology of the leukotrienes? We will discuss now. What are these leukotrienes? So let us go back. Arachidonic acid. We learnt about COX-1 and COX-2 pathways, right? Coming to the lipoxygenase pathway, what happens with this arachidonic acid? There is an enzyme 5-lipoxygenase. Okay, it undergoes multiple steps to the formation of these leukotrienes. Okay, after these multiple steps, what happens? Leukotrienes are formed. The first leukotriene formed is LTA4. This is highly unstable. Okay, this is highly unstable. So if at all, if I target this 5-lipoxygenase enzyme to block this, is there any drug which can block it? Yes, xyluton in inflammatory and anti-inflammatory nature used in asthma conditions. What is the fate of this LTA4 after formed? This LTA4 can be transformed into LTB4. Okay, what is the nature of this LTB4? It is highly potent chemotactic. It is synthesized in WBC. Okay, what are the receptors for this LTB4? Receptors. Receptors are very easy for these prostaglandins. Okay, it is B, right? B for LT. Okay, there are two types of receptors. That's why for LTB, these are the two receptors on which LTB4 acts. Okay, and there is another fate of LTA4 transformation. It may transform to LTC4. Okay, again this LTC4 transforms into LTD4. It occurs in extracellular. When LTC4 goes out of the cell, this conversion will happen. Okay, or it may have convert into LTE4 also. Okay, and this LTC4 and LTD4 and LTE4, these three together are called cystinyl leukotrienes. So in short, we call them as cystinyl leukotrienes. Okay, what are the receptors for these leukotrienes? LTC4, LTD4 and LTE4? There are three types of receptors. Cis LT receptor type 1, cis LT receptor type 2, This is LT receptor type 3. Okay, what is the function of this LTC4, D4, E4, that is the cysteine leukotrienes? These are highly potent bronchoconstrictors. These are powerful bronchoconstrictors. Okay, if we compare the potency of these ones, potency of bronchoconstriction, if we group, if we compare this cysteine leukotrienes, okay, these are highly powerful bronchoconstrictors when compared to histamines. How much those are more powerful? Almost 1000 times more potent than histamine. Okay, so this is highly bronchoconstrictor, powerful bronchoconstrictor. So it is very dangerous in asthma patients. That's why for asthma patients we target the ligands which are acting as antagonist for these. So what are the antagonists available in the market for cysteine leukotrienes? Currently we have antagonist only to this receptor, cysteine leukotriene receptor type 1. What are those antagonists? Yes, leucasts. What are those leucasts? Zafir leucast, Pran leucast, Monteleucast. These act as antagonist to these receptors. Which receptor? Cysteine leukotriene receptor type 1. Where are these used? Mild to moderate asthma. Mild to moderate asthma. These leucasts are used in mild to moderate asthma. But how many drugs are there in the market? If we compare the efficacy in asthma treatment, steroids are powerful than either if you take xylutan or these any of these leukotriene receptor 1 antagonists. When we compare all of them, steroids always stand more efficacious in the asthma treatment. Steroids are more powerful than these drugs when we compare the efficacy. Got it? So by now this icosanoid topic is completed. So for any queries, feel free to post it in the comment box below. And if you want to send me any email for any queries, send me email to farmanandan@zohomail.in. Well, thank you.